So today I'm going to talk to you about a controversial subject, which is bracing after lumbar surgeries. There's a lot of surgeons out there that will pretty much put a brace on everyone. And in my opinion, I am strongly against bracing after surgery if it is possible, just because bracing interferes so much with people's ADLs. They can't do their daily tasks as well. And there's a lot of surgeons that will brace patients while they're you have to put the brace on while they're supine in bed. And this is just so difficult, and it's painful for the caregiver, for the therapist, for the nursing staff, anyone that has to put these braces on for the patient in bed. And it's also more painful for the patient. And a lot of these patients that are going home on their own, like if they live alone, they have to put these braces on by themselves. If these patients are going home alone and they have to put these braces on by themselves, this is really challenging for them. A lot of our patients, they can't even do it, and so we can't recommend that they even go home. And so it's just a big problem anytime you have to put a brace on supine in bed. But bracing in general, I think it impacts people greatly. It affects their discharge plan, and it slows the recovery process. And so I am obviously strongly against bracing if it's possible. I know there are some cases when people have cognitive issues, they're not following their spinal precautions well. Those people definitely, I would agree that they need bracing. But I think a lot of people don't need bracing, and so that's why I wanted to talk about this subject today. So recently I went to the Neurological Symposium in San Luis Obispo. We had some people that were neurosurgeon in San Luis Obispo, and then also this was kind of a collaboration with some professors from UCSF. So Ben Hendricks, who is the neurosurgeon kind of presenting on this, he actually was studying under someone who pioneered the approach to minimal invasive surgeries, which is going in laterally and going in with like this small little tube. And it was kind of really interesting to kind of hear about this. In the future, if I ever have to get back surgery, I think I'm definitely going to go minimal invasive approach. It just seems like a lot better. But what he had to say about bracing is he brought up some articles that I had been reviewing before. And what it was is the main article was this meta-analysis. And what the article says is there's no definitive recommendations for post-operative management of patients after spinal surgery regarding activity restrictions and exercise therapy. It's saying also that more research is needed, but it's kind of saying that most people don't need a brace in general. And so this surgeon has kind of taken on him to just stop bracing a lot of his patients. He will in some circumstances, but he also kind of said that this is kind of a surgeon-specific question. So every surgeon is going to have a different way of doing the surgery. Every surgeon is going to have a different opinion about this. So bracing is still kind of up to the surgeons on what they think is best. But for the most part, bracing isn't as important as it was seen to be seen in the past. Now, I was also able to ask one of my questions from a panel of neurosurgeons. One of them was from UCSF, kind of like a visiting professor. And I asked them, what's the benefit of a TSLO, like a soft brace, versus one of those hard clamshell braces? And I know a lot of places, a lot of hospitals that you go to, they have completely gotten rid of the clamshell brace altogether. They're only using the soft shell brace. The hospital that I work at, it seems like we see a lot of patients that get the clamshell brace. And it's usually in cases where it's like a larger surgery, there's more levels, or it's a patient that had a burst fracture and they're just really concerned about the placement of the patient and what could possibly go wrong. And so they put them in this clamshell brace just to, cover themselves. And the problem with the clamshell brace is they're so hard to get on, especially like they have to be put on supine in bed. You can put them sitting up, but it's not really the proper way to put them on. And so a lot of our surgeons have the patient don these while they're laying in bed. It's super painful for them. It's painful for us because we're bending and we're twisting and we're trying to get this thing on there. And what they had to say about this was that in most cases, like those hard, rigid clamshell braces are not even helping the patient as like the higher you go, like on the thoracic side. But they were saying that in some cases it can be beneficial if you're concerned about the patient and they had a burst fracture, and any movement, could possibly present more of an issue later. In those rare circumstances, the surgeon will actually recommend them. So I kind of came walking away with this thinking that a lot of the older surgeons are probably going to still recommend bracing. Some of the younger ones aren't so much. I kind of experienced this when I was living in Las Vegas, where I felt like a lot of the younger surgeons were just kind of moving away from bracing in general. But I still see it. You know, if there's a patient that has cognitive challenges, or maybe they're just not adhering to their precautions, they're definitely going to be wearing a brace. And then there's going to be a lot of patients that have these more complex issues like a burst fracture, where brace is definitely indicated, and in some cases they'll use a clamshell brace. But for the most part, they're not really indicated if you had just like a regular surgery. And as therapists, I think this is just kind of helpful to understand that, I mean, we don't really make the decisions on whether these patients wear a brace or not. And for us, it's really challenging working with patients and donning these braces, especially when they're supine in bed, because it's really limiting these patients and impeding their ability to progress. And it's also like bad for our back. And I think it would be really helpful, I think for all of the neurosurgeons out there, all the people that are doing lumbar surgeries, and also the people doing research to not look at bracing as like, is this gonna be beneficial for the patient? I think that you also need to look at the greater scheme of things, right? So it's not just about the patient, but it's also about the caregiver, about the therapist, about the nursing staff, about everyone that's going to be helping this person put on this brace while they're in bed. Because a lot of times I'll have a patient that has a burst fracture and they're in a clamshell brace, and they have to be in that clamshell brace per the doctor's orders for 3 months. And I'm talking 24 hours a day, 7 days a week for 3 months. This is uncomfortable. This can cause pressure ulcers. It is painful. If the person has to shower and maybe we can just remove part of the brace at a time, it's just a nightmare. And then also helping them to get dressed and doing their daily activities seems next to impossible. And then also the caregivers that have to help them with the brace and help adjust the brace. I think it would be helpful if surgeons were thinking not about like how this affects the patient, but also how it affects everybody else, like how it's going to affect, because I think if you're thinking about things that way, you're going to be less likely to recommend bracing. Because if you have a CNA or a nurse or a therapist that is putting on this brace and then tweaking their back and then like putting their ergonomic risk factors in a place that could lead to injury later on in their life, I think if we see things that way, like there would be a whole lot less bracing in general. And maybe that's just because I don't think bracing is that important, and that's like my personal opinion about bracing. When I see these patients put on these clamshell braces, I don't feel like they protect them at all. I don't think it's really making much of a difference. When you get the person from supine to sitting, especially if they are a larger patient, if you're getting them up, they are definitely going to be doing some twisting. But I think really it's not about just the patient, it's also all these people that are helping the patient. And if we're also going to put them in harm's way, I think we should try to get rid of bracing as much as we can. And I really do think that there's some more studies down the road that kind of get rid of bracing and talk about these other effects that bracing causes, because it's not just about like, is this preventing them from bending and twisting and causing damage to their spine after surgery. We also need to be considering like, is this impeding their ability to progress, to perform their daily activities, to be discharged from the hospital? And is it also causing other possible back issues for other people that are treating these patients? So that's kind of my rant on back braces today. I just kind of wanted to bring it up because I think, although it is really controversial, I have a strong opinion. I think that we should be doing away with them more so. I'm not saying that it should be like that in every circumstance, but if a patient is supine in bed and putting on a brace, I think that is going to be causing the most harm to them, okay? So it's going to cause harm to the patient, it's painful, it's causing harm to the person that's helping them put the brace on, and then I don't think it really makes much of a difference putting the brace on in a supine position to sitting position. And maybe that's what I kind of want to clarify here. But I think that we need to talk about that more and get clear with the surgeon that's writing these orders to wear the brace. Because if the patient is already in a sitting or standing position, the brace is a lot easier to put on, and it's it just doesn't cause as many issues. So it's kind of nice to just hear like a younger surgeon out there that is kind of confirming some of the things that I've kind of already thought. But I think we need to kind of take that to the next level and notify the doctors that are working with these patients that a lot of times it can cause more damage for the person working with the patient when you're donning a brace while they're laying in bed. So it was really cool to attend this event and just kind of get a better understanding of like what the surgeon's thinking, and understanding that it's not in all cases that these patients actually even need surgery to begin with. And in the circumstances where they do, like there's a minimal invasive approach that could possibly be better. And I am excited to kind of see how that goes down the road in the near future. And also share your thoughts below. I want to hear your thoughts on bracing in general. This is a controversial topic. I think a lot of people have a different opinion about it. As therapists, we're constantly trying to get the person to become as independent as possible. And so I think a lot of us just have this mindset that we don't want the braces if we don't have to have them. But I want to hear your thoughts, share them below, and please like, subscribe, and I'll see you in the next one. Thanks.